This chapter covers students with severe disabilities. Now, it's important to understand that when you hear someone has a severe disability, it could mean a variety of things. It could mean that they have the severity of maybe one disability is extremely severe, and they may have other disabilities that are not. It could be the combination of just multiple disabilities, and those multiple disabilities do not necessarily have to be in a at a severe nature, meaning we have students who have ADHD and it's been checked off as severe, but their anxiety is checked off as moderate. Their depression may be checked off as mild, but the combination of the three together um, makes them qualify as an individual who has a severe disability. Um, and here are some other examples from your textbook of different terms that you might hear when people have severe disabilities. So similar to what we discussed a few weeks ago about the two types of supports that are available to families, when it comes to individuals with severe disabilities, it's the exact same thing. They have formal supports that are available. As you may remember, the formal supports are the things that are put in place formally. Teaching, healthcare, therapy, even anyone coming into the home and providing respite would be considered formal because it's usually a person who has been trained in a certain field to tackle a certain deficit, behavior. It could be parent training, which my husband and I have had to go through a few times because it's necessary when you're raising a child with special needs, and especially one who has multiple special needs. And then you have the natural supports, which, if you may remember a few weeks ago, it's just the things that are naturally around you. It could be family members that live with you. It could be family in the city. Even now, with everything going on, it could be, family literally anywhere in the world. It could also mean church. It could also be just friends. I have friends who are in different, who work and they are experts in different areas of education and psychology. So even though they provide a formal support to families, because we have a natural friendship, I can lean on them at any time, and vice versa, for insight, from a parent, or get insight from a professional. So these are just different things that are still available, and they are there to help with integration and help the student and the individual develop independence as much as possible. When it comes to last week, we talked about CBI, the community-based instruction. Here are some examples of functional curriculum domains. So once upon a time, and I'm not sure if this still exists in the high school arena, there would be like a class just for home ec and for sewing and things of that nature. And so these would be classrooms set up like kitchens or a sewing room. And so that way the students could get a real life experience. I say real life, and then you say, well, it's a classroom set up like like a bank. Well, for those with special needs, sometimes they need to be able to go into a mock environment. That way they get an opportunity to not only, see what it looks like in a typical bank, but also they can work on behaviors before you move into an actual, setting where they may not be as gracious. Recreation and leisure, you have the YMCA, you have parks, which San Diego has plenty of. There's movie theaters as we begin to do that again. You may have to teach the child the different things that go into these areas just so that they can feel successful when they actually do it in real life. You have the vocational, specific job sites. My son underwent training when they got ready for him to work at, where did he work? Round Table, because they wanted him to be aware of the different safety precautions he needed to take when loading the ice maker. He needed to wear gloves when changing out or filling up the condiment shakers. So there's different things that people just have to be sometimes taught, especially when they have multiple disabilities. And just like we've discussed in other chapters, sometimes you may have to teach social skills. You may have to teach how to button a shirt, buttoning pants. There's little kids get the snap option. They may have buttons. They may have the little, and just like that. I can't remember the name of it, but you know how they have like the overalls and they kind of have that little weird hook, but it's secure. And I just love to see little kids in overalls, but they struggle with getting that off and on. And so sometimes as they get older, especially if they lack fine motor skills, they may have a hard time grasping, holding on to the shirt at the same time, and or the bib of the overall, I should say, and the little, I don't even know what you want to call it, to take it off and unhook it. And then from there, you can have when you're dealing with students with multiple severe disabilities, it's important that they have the proper communication system set up. Now, if their communication skills are pretty much, close to their peers, then they may not need additional communication systems in place for them. But there's a variety of ways, and this video that we're going to watch in a few seconds will go over that more in depth. But the whole purpose of it is that you want to take advantage of any existing communication skills that the student has. So you don't want to take away, if you're able to understand 50% of what they're saying, you want to give them an opportunity to use that 50% of communication skills. And so you want to pile on other systems that help get him or her as close as possible to 100%. You definitely don't want to put something in place and say, okay, now the iPad is going to speak for you, and then they don't get a chance to use the communication skills that they already have. You always want to select functional communication targets. And it says identify powerful teaching opportunities. Well, that just basically means any opportunity that you get to teach, you want to lean into it and not just wait until Johnny is back in the classroom in his seat, or when Johnny's aide is here to help out when you're doing recycling around the school. You just want to constantly take advantage of teaching opportunities. In the past, I've shared how I acted as the liaison between my son's therapist, his doctors, and his IEP team. And because I was strategic in making sure that we were all speaking the same language, whatever strategies we were using in therapy, we used them at home. I shared them with his teacher. And so that way, Caleb continues to hear it. And even to this day, he understands what quiet hands mean. Now, just because he understands it doesn't mean he always follows through, but we have behavior strategies in place to address that. But you want to always take advantage of any opportunity to strengthen a deficit. And this is really where the parents step in, because obviously as a parent of a child with a disability, if the parent is in tune with what's going on and has a realistic viewpoint of their child, there are plenty of opportunities to lean into other ways to strengthen the skill that's being taught, the strategy. If you're trying to reinforce a positive behavior versus a negative one, there's multiple opportunities. And I say all that to say, again, parents play a huge role in this piece because they're around their child more, especially now with everyone being pretty much homebound. But if you come across a situation where a parent isn't as involved, and it could be for a number of reasons, then in that case, you have not just the teacher, the IEP team. If the student is receiving outside support from a doctor or a therapist, then there's a possibility. I'm not saying that just because the parent isn't hyper involved doesn't mean that the child won't succeed. The child will succeed if other people are doing their part, but it's just a reality. I'm just going to stop there on that. Facilitate the widespread use of the new forms of behavior, once again, similar to what I just said, and then ensure maintenance of the new behavior. So if you're trying to get a child to stop hitting you to get your attention, and then over time you start to see, and I don't mean just over time, like after a week or even a couple of days, it's just like, well, if he hit you to get your attention at 9 o'clock this morning in class, or if you're sitting in Zoom, because that's a reality now, and they're constantly raising their hand, you want to give them a replacement behavior to let them know that you've seen them and you heard them and you will get to them, but also give them an opportunity to understand why it's important for them to wait. So this video, like I said, that we're going to watch, is going to go in depth into the different types of functional communication systems. Okay, so now that we've watched that video and had a chance to discuss it, The last thing when it comes to children with severe disabilities to consider is transition programming. This was mentioned last week as well, the different um, times in a child's life when they will engage in transition, as it states here, between levels of school, segregated to integrated settings. And this means going from they could be in a 100%, they could be spending 100% of their day in a self-contained special education classroom. And then as they move into general education, they may be in an inclusion classroom. So they may be in there with other students who have IEPs and 504s, and then, depending on what the goal is, they may move completely into, general education. Like I said, it's all dependent on the child, their abilities, how their disability impacts their life, their education life, that is, and the resources that the school system has available. It's important for everyone to understand that just because your school may or may not have a certain technology, device, resource, the school district as a whole may have access to even more resources. So usually, I say usually, and then someone's going to say, well, that's not like this at my school. But in my experience, the special education area was always covered by one of the assistant principals. And in my son's first high school, it was covered by the vice principal. But start with that person and ask him or her, what is available, if you know that you have a student who would possibly benefit from having an iPad for communication systems or for behavior or for transitioning even between activities, and I don't know, whatever, you have a reason for it. Find out what resources are available, and then contact your special education department within the school system to also find out what is available. And sometimes it's not necessarily devices. They may have people that can come out and observe and start to collect the data so that you can go ahead and possibly put additional interventions and supports in place. And so in the next chapter, we're going to talk more about individuals with behavior disorders and how that impacts their education.